So today we're going to be going over chapters 12 and 13, solution-based therapies and narrative. Um, and again, with any of these theories and modalities, you're going to find what works best for you. You may not get to experience that fully until you are maybe on your own, but um, you will get to pick what works best well with your style, what you feel is most effective. There's no right or wrong as far as which modalities you like to use. I think there's a personal preference and what you feel most comfortable administering. Um, so just keep that in mind as you're learning and maybe get to practice as time gets closer, that you um, will get to kind of see what's the best fit. Okay. Common solution-based therapy myths. Solution-based therapies propose solutions. Solution-based therapies never talk about the problem. Solution-based therapies never talk about the past, and emotions are not discussed, which is all untrue. And so solution-based usually is used quite often because there's kind of a level of um, quickness to it. Not because it's not talking about the things of the past, or not because they're not wanting to get into problems, but because there's a level of like, let's stay focused on the solution here. So you're going to see a lot of these modalities in places where we're looking for, we don't have a lot of time and we kind of need to address some things. You'll see that sometimes in school-based settings. You'll see it maybe potentially in a like more of a inpatient type setting. But it is it's a common modality to use. So here are some of the strengths. Include resources in the person's life. So what are their supports? Therapists often have to ask several questions and attend to vague clues. Key to successful assessing strengths is belief that all clients have meaningful strengths. So there are some strengths somewhere. Some of the, contributors: Berg, Linda Metcalf, Steve DeShazar. There's a lot of different spin-offs of solution-oriented therapy. Just kind of like mindfulness is kind of a spin-off of cognitive behavioral therapy. You'll see this in a lot of different theoretical orientations, adaptations to the theory, or adjustments, or maybe specifications to certain types of groupings of people where it will work well with. So just something again to keep in mind. So small steps to enacting solution. Therapist helps clients identify preferred solutions. What are the small active steps? Often time limited, so 1 to 10 sessions. In more complex cases, such as the treatment of sexual abuse or alcohol dependency, therapy may take years. And that is true. And so solution focus may not be a great idea for everybody, and that's okay. It really depends on the situation at hand and what the situations are that are affecting the person. The Zen view of viewing beginner's mind. Therapists should be curious about how this person experiences his or her unique symptom. Echoing the client's keywords using client language makes problem more solvable and engenders hope. Carl Rogers with the twist: reflection, difficult feelings and behaviors or thoughts reflecting on a time, context, and a relational limit. Optimism and hope assume that change is inevitable, which is a positive thing, right? And view all clients as capable of enacting solutions, which is also great. Also very, very good. So what works? Finding the exceptions. So exceptions provide clues to what works and what clients need to do more frequently. I think a common solution focused kind of question is, whatever you're doing now, do the opposite. So if it's not working for you, why do you keep doing it? And that's kind of like, let's get off the roller coaster. Like, what are we doing that's causing us to be on the roller coaster? And let's just stop those behaviors. That's a lot easier said than done. But that's some of the idea, is we're doing things that are causing the madness. So let's stop the madness and let's change what we're doing. And let's really look at those changes so we can have different outcomes. Therapist identifies exceptions and descriptions of what works indirectly by listening, directly by asking questions, and uses exceptions to help clients enact preferred solutions in their lives. So exceptions provide clues to what works and what, so like for the example here, it says his ADHD is less of a problem in his math class. So let's think about why is it less of a problem in math? That's kind of, well, that's one kind of weird, but why is it less of a problem? And so let's research that and be like, okay, so how can we maybe apply that in other areas, right? That's kind of what the therapist is helping with the clients to do. Client motivation, visitors don't have a complaint. Others have complaint against them, typically brought to therapy by other. Complaints can identify the problem, expect therapy or someone else to be the source of change, and customers can identify a problem, want to take action toward a solution. And so positive goal descriptions emphasize what client is going to be doing, does not focus on symptom reduction, and clear descriptions, clear specific behavioral indicators of desired change. So how do I know this is a change, right? Looking for those outcomes, which will help clients. See, and I think when clients start to see change, then they're able to, like, that motivates them to keep going, right? Like when we look at weight loss or things of that nature, it's like when someone loses weight, that motivates them to keep going in the direction, or they're getting the outcome they want. If someone was wanting to build muscle and is starting to see definition, that motivates them maybe with whatever they're doing to get the outcome, like whether it's eating a certain way or a certain workout regimen or whatever. So it's like when you start to see the changes and can identify them or see the positive like the positive behavior, it really motivates people to be different, you know? Scaling questions, clients define goals and rate progress. So at a scale of 1 to 10, how are you feeling about this situation right now? This is a way of just kind of gauging where we're at, maybe to be able to say where you started, where you're at in the middle of progress, where you are at the end. It helps kind of track and keep record. There's also like things that people ask, like in solution focused therapy, like the $1 million question. Like if you were to wake up tomorrow and life were to be exactly how you want, we call it $1 million question, miracle question, what would be different? Being able to kind of gauge, like, what are they looking for? What is this that they're wanting to be different? But asking these kinds of questions can be helpful. And this is, again, when you decide to seek help, things at their worst, great way just to kind of gauge and like track with people what's going on with them. Okay. The tenets for intervention: if it isn't broke, don't fix it, which is great, right? And that's kind of goes back to the past. If it isn't broke, don't fix it. Like, people can have very troubled past, but if it's not causing them harm in their current situations, it may not need to be something that's addressed. And so that's something to take into consideration when working with clients, is like, we may not need to disrupt something. We might just need to focus on what's not working for them. If it's not working, do something different, kind of like I mentioned with the roller coaster. Small steps can lead to big changes. The solution is not necessarily related to the problem. The language for solution development is different from that needed to describe a problem. No problem happens all the time. There are always exceptions that can be utilized, like what we're talking about, like the ADHD. He doesn't have it in math. So let's talk about that, right? The future is both created and negotiable. And that's where, again, utilizing client strengths can be so helpful, because you're using things that they already have going for them to work with them to achieve an outcome that they want. So formula for session tasks, scaling questions, asking suppositional questions, utilization, coping questions, compliments and encouragement, therapeutic compliments. Okay, those are some of the interventions. A lot of question asking, being kind of strategic in those questions, to get out the information needed to kind of focus on the target. Couples therapy and divorce busting. Solution-oriented couples therapy is popular because the emphasis is on strength and hope. Good with couples who are in crisis or considering divorce. Solution-oriented couples therapies have unique interventions. And so, again, like, kind of working on, like, what's broken, how do we fix it? We're not fixing what isn't broken. Therapy for sexual abuse and trauma. Therapist takes an optimistic and hopeful stance that emphasizes the resilience of survivors. Interventions honoring the agency of survivor, the recovery scale, 3D model, constructive questions, and video talk as far as action terms. Okay, so there's a lot of different modalities that we can use for that form of therapy. I'm sorry, a lot of different interventions. And if you did have any of those myths or have heard of it before, hopefully some of those were derailed by just hearing a little bit more about solution focused. Like I think it gets a bad rap because it thinks like, well, you're not really getting into things. And that's not necessarily true. It's just that maybe people don't have time to get into it. And again, that's not what's bothering them. So we're only working on what's bothering them. Okay. And then therapy ends, and that's great. Narrative therapy, which is a great form of therapy as well. In a nutshell, the least you need to know. Based on the premise that so our story, and create the meaning of our of life events using available dominant discourses. People experience problems when personal life does not fit with these dominant social discourses, societal discourses, and expectation. Process involves separating the person from the problem, which is always so huge. Clients identify alternative ways to view, act, and interact in daily life. Dominant discourse, culturally generated stories about how life should go, used to coordinate social behavior, how married people should act, what happens, what looks like, how to be successful, etc. Local discourses occur in our heads. Closer relationships are marginalized in communities, have different goods and shoulds than dominant discourses, and therapists help clients become aware of how different discourses are implementing their lives. Some people will have just such a negative narrative of who they are and what they're about. I think a lot of this goes back to expectations of how people think things should be versus how they are, which creates a lot of discourse and frustration for people. I think a lot of clients have an idea of what life should be like and what family life should be like and what their partner should be like and what they think they should be like. And then they're constantly disappointed, or maybe an event happened that then derailed them or changed their trajectory, and then their narrative, their story of themselves becomes so tainted. And so that's where narrative can be super empowering, because it's causing someone to change their perception of themselves. Here are some of the significant contributors: Michael White, David Epstein, Jill Freeman, and Jean Combs, Gerald Monk, and John Winslade. Treatment phases in narrative therapy: meeting the person apart from the problem. You are not your problem. Listening to the effects of the dominant discourses. Even having that language of separating the person from the problem is so huge. Like, even with addiction, being like, that's your addiction, that's not who you are. I think it's powerful to be able to separate that. It causes people to kind of take their power back a little bit. Identifying new ways to relate to the problem. Strengthen preferred stories and identities. Thickening of descriptions. So when people experience problems, they tend to notice only events that fit with problem narrative. Instead of replacing problem story with a problem-free one, therapists add new layers to problem-saturated descriptions and helps clients create more balanced, rich, and appreciative descriptions of events. Meet the person apart from the problem. So ask the client's hobbies, daily activities. The problem is the problem. The person is not the problem. How can we have hope? Therapist and client engage in a joint process of constructing meaning. Therapist does not rewrite client's story. The client needs to rewrite their story. But we have the role of investigative reporter. So intense curiosity, wanting to know all the details of the story, which helps bring up all the things for them to see what they need to do. Case conceptualization, problem-saturated stories, story in which the problem plays leading role and the client plays a secondary role. Unexpected outcomes, sparkling event stories, or subplots in which the problem-saturated story does not play out in its typical way. Dominant cultural and gender discourses, discourses that most directly inform the perception of a problem. Local alternative discourses, that do not conform to dominant discourse. And then goal setting. So enact preferred realities and identities, increasing client's sense of agency, autonomy, separation from the problem, right? I am not my problem. You're going to externalize. And the middle phase targets immediate symptoms and presenting problems. And then we're going to try to get to our personal identity, relational identity, and then how we overall act in a community. So externalizing conceptually and linguistically, separating the person from the problem, shifting the client's perception of the relationship to the problem, from having it seeing it as from having it to seeing it outside the self. Like, I am not my problem. That separation is really huge. There is different techniques you can utilize. The mapping influence of the problem. So trying to get, and this is where writing can be used a lot in this form of therapy, and trying to, articulate, which is a way of getting it out, right? The separation, getting it out of your body, getting out of your mindset, and trying to navigate what is going on, with the problem that's not me. Like, I am my own person. This is the situation. And the therapist asking a lot of good questions can help with that. And again, the whole idea is we're trying to change their story, not because it's made up, but because this is who they are and this is who they could be, versus maybe the lens they're viewing themselves now. Okay. And so there's different categories: that negotiating and experience near definition, mapping the effects, evaluating the effects, and of course, lastly, justifying the evaluation. And so again, trying not to see everything as all bad. Such descriptions promote dualistic either or thinking, like I'm only worthy of love when I do something for somebody else. And again, can invalidate to the client, and make the problem, some of the problems seem bigger than what they actually are. Externalizing questions, so used to help clients build different relationships with their problems: depressed, depression, anxious, anxiety, angry, anger. When did you first notice depression influencing your life? Like, separating it from you, the client. Assumptions: presume the person is separate from the problem. So presume the person has a two-way relationship with the problem. So the problem affects the person affects the problem. So, again, you are not the problem, which that's a lot of our language we use when there's issues or situations arise. It's like, even with kids, it's like they are the problem, when it's like, well, this choice that they're making is the problem, or this behavior that they're having is the problem. Like, they are not bad, right? But we do that a lot. We group things together and identify people with like a certain behavior or a certain mentality, and then they kind of own it as part of their identity, when it's like, no, that's just something they do. That's not necessarily who they are, because there's a lot of different facets to us. Like, sure, some of our poor decisions is one portion of who we are, but that doesn't make us who we are. And so narrative was really kind of honing in on that, and like allowing the person to take a step back from that and not own it as who they are. Maybe something they do, but not who they are as a person. This all empowers clients to make conscious choices about which discourses they allow to affect their life. The therapist listens for gaps in the client's understanding and asks them to fill in details. Target problematic beliefs, practices, feelings, and attitudes by identifying history, context, effects, interrelationship strategies. So identify a unique outcome. This is mapping and landscapes of action and identity. Map the landscape of action. So critical events, things that have happened, circumstances surround those, like what we just talked about. What was the sequence and like the overall plot? And then how did the client respond to this? Is how it's been mapped into their life. Scaffolding conversations, used to move clients from that which is familiar to that which is novel. So trying to do some distancing tasks to help them see they are not their problem. Permission questions therapists use to ask permission to ask a question. And so again, a lot of question asking, trying to get clients to see outside themselves and outside their circumstances. And again, to rewrite their story, to rewrite their identity, to see that they are not this circumstance. Again, very powerful. Maybe wouldn't work with everybody, but very powerful, very useful. And again, I think we see a lot in people's stories, how tainted they can be or negative or critical. And really, it's limiting, especially when we look at what's ahead and what could be. It's really squelched. The fire is really blown out by some of this critical lens. Um, so anyways, I hope this information's helpful. We're on week 6. I can't believe it. We're moving right along, almost to the end. So hang in there. And I hope you guys have a great week.